Hello friends, I'm Dr. Shiv Chopra, consultant surgeon and laparoscopist at Moolchand City, New Delhi. So how do we diagnose gallbladder stones? Usually the symptoms. So gallbladder is an organ which is hanging below the liver. Most of the patients usually have pain which is right upper abdomen to the side just below the chest wall. It can radiate to the back. A lot of patients also come with what is known as flatulent dyspepsia, the problem what they normally describe related to having excessive bloating and gas formation. Looking at these symptoms, most of the times patients ignore, since if there is no pain, then patients keep on thinking that it's something to do with the food they are eating, and they carry it, and the disease keeps on increasing inside till it comes to a point where they either have the second degree symptoms in the form of pain or jaundice or vomiting. Nowadays, to diagnose the gallstone, we have a very simple modality, ultrasound. It is the investigation of choice which helps us in defining the gallbladder, the stones, the nature of the stones, the size of the stones, and what is the position of the small duct, which is known as the bile duct. Once we have symptomatic gallstones, then obviously the treatment, if a patient is fit, is what is known as cholecystectomy or removal of gallbladder stones. This is possibly the commonest surgery which is done in the world. And as I said previously, probably related to the modern day living, the times when we were training, gallbladder stones were usually identified in fat, fertile females who were multiparous, age usually around 40. But now you have gallbladder stones seen all across in ages. We have seen the youngest being 6 years old till any time, any age. So once we diagnose gallstones which are symptomatic, then obviously the removal of gallbladder is on. The surgery is commonly done these days by what is known as the laparoscopic technique or the minimal invasive technique. And with some more refinements now, some centers are also using the robotic technology. Patient usually comes in the morning fasting, 2-3 small cuts are made through which the telescope and the instruments are inserted inside the cavity and the gallbladder comes out. Most of the patients go home the same evening. A few, depending upon how they fare in the anesthesia and depending upon the multiple medical issues they have, usually wait for a day or two before they settle down. And most of the patients get back to work the next week. It is a fairly simple problem tackled by a revolutionary surgery, the minimal access surgery, provided it is handled in